So that should let people in now. And it should have started recording straight away.
Yeah, it did.
Yeah, there's the numbers coming in. Should we give it like 2 or 3 minutes for people to join?
Yeah.
Go. Everyone can look at my half attempt to bring Christmas to the world.
Okay, it's 10:32, so I think we'll get started. Welcome to this webinar on sexual pleasure in health promotion. I'm Jo. I will introduce myself and Chris, my co-host, a bit more in a second, but first things first, we need to do just a little bit of housekeeping. It's slightly less housekeeping than if we were in person, but just to let everyone know, this session is being recorded. If something happens and one of our internet drops out or any of your internet drops out, just try and rejoin. You should be able to get straight back in and we'll just pick up where we left off. Hopefully, touch wood, that doesn't happen. Down at the bottom of your screens, you should see a Q&A box and a chat box. The chat box we will be using throughout the webinar to kind of get you involved in certain discussions. And if you pop any question and answers in the Q&A box throughout the session, we will do our best to answer them towards the end of the session as well. So I am going to share my screen. We have a presentation for you and we'll take it quite quickly, but again, feel free to ask questions at any point and we'll pick up anything at the end that you maybe missed or we covered too quickly. So can everyone see the presentation? Chris, can you see it? Thumbs up.
Yep, I can see it.
Okay. Grand. So first things first, we are Waverley Care members of staff. So I'm Jo and I manage the WAVE team up in Inverness. WAVE delivers sexual health and relationships education and information to under 25s throughout Highland and Argyll and Bute. We also deliver professional training like this to support staff that work with young people. WAVE and Essex, I'll let Chris introduce Essex as he works for them, but WAVE and Essex are both Waverley Care projects. Waverley Care is Scotland's HIV, hepatitis and sexual health charity. We've been established since 1989, so 31 years we've been doing this work, and initially the work was focused around HIV diagnosis in Scotland and supporting those people that were at the time definitely more at risk from severe or end of life HIV diagnosis or AIDS diagnosis, but thankfully HIV treatment has come a long way since then, and now a lot of our work is focused on supporting people who have HIV but also challenging the stigma and raising awareness about health promotion around sexual health, HIV and hepatitis. Chris, do you want to say a few words on Essex?
Yep, so I'm Chris. I'm a health improvement coordinator with Essex. So Essex is a Waverley Cares project for gay and bisexual men and all men who have sex with men across Scotland. So we provide sex, health and wellbeing information. All of our information is led from a very sex positive position. So we talk about good sex, we talk about pleasure, but we also talk about prevention and looking after your mental health and relationships in that. We provide person-centered support for gay and bisexual men, so that's what that little acronym is for GBMSM. We provide testing information to make it a bit more transparent and clearer, more specialized resources, and we also provide online support and outreach through apps and also different websites and different services.
What we're going to cover today, we're going to talk about what is good sex and kind of the legislation that supports the inclusion of pleasure throughout sexual health prevention and promotion. We're going to talk about sexual identities and bodies a little bit, and where kind of those two topics sit within pleasure and how they can be used to promote pleasure. We're going to have a quick comfort break after that for a cup of tea in the middle of this session, so don't worry, you'll all get a cuppa in about an hour's time. After that, we are going to talk about how Wave and Essex services include pleasure in our practice, and we're going to round up by some tips for other professionals to include pleasure in their practice as well, before a Q&A at the end. I've put a trigger down here. We're not going to touch heavily on abuse or sexual violence, but obviously any kind of sexual health topic you're talking about can bring up negative experiences around sexual violence. We will talk about it briefly, but more in the context of how we can combat it in terms of positive messaging around sex and relationships. The aims of the session today are to increase understanding of why talking about pleasure is important, to know how external influences, including our own values as practitioners, can impact on our services and our service users, to gain confidence in talking about sex and pleasure, and to be able to identify ways to include pleasure in your own practice. I've already talked a little bit about using the chat box in the Q&A, but we were going to keep reminding you to pop any questions you have in the Q&A box, which Chris is monitoring. If anything comes up at a time when we're talking about a related topic, we will try and include it in our conversations at that time, but mostly we're going to save questions for the end of the session. Okay, so I want everyone to just take a couple of minutes to think about why talking about sexual pleasure is important to everybody. You can add comments into the comments box below, which Chris is monitoring, but just take a few minutes about why in your practice it might be important to include sexual pleasure. Okay, so first things first, we're going to start with thinking about how policy, research and legislation supports the inclusion of pleasure in practice. So a lot of practitioners, I think, can be quite wary of talking about sexual pleasure, as they feel it might mean they have to actually talk about sex itself and different sex acts, and be quite specific about what they're talking about in terms of the sex their service users are having. This isn't necessarily the case. I think you'll find out throughout our presentation that we very much approach it in terms of topics we're already talking about with service users and including it where possible. And it's more about having a sex positive approach to the work that you're doing. However, there is legislation and policy that does support the inclusion of pleasure, just to reassure those practitioners and professionals that are a little bit conscious of it. So the World Health Organization says sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It's not just about tackling STIs or people becoming ill because of their sex lives. It requires a positive and respectful approach to relationships and sex, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. For sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. So as you can see, the working definition of sexual health is very broad. It does include pleasure and it does include general well-being, which of course is very important when so many people are having sex and it's such a big part of day-to-day lives. The sexual health and bloodborne virus framework is currently being kind of rejuvenated. As you can see, it ran until this year, so it's currently being worked on and updated. However, you will see the outcomes of the last framework here do include talking about, again, relationships that are free from coercion and harm, and the best way to tackle abuse and harm is to promote what's good so people can identify what's good and what's bad. A society where the attitudes of individuals, the public, professionals and the media in Scotland towards sexual health and bloodborne viruses are positive, non-stigmatising and supporting. I think that's a huge influence in people's relationships and the support they need but don't want to access from fear of being stigmatised. We will talk about that throughout the presentation, but as you can see, it was specifically laid out to tackle stigma and become a more positive society in Scotland in the framework as well. This is more from the framework. So good sexual health is not only about reducing disease, but also about improving sexual well-being. So they're kind of echoing what the World Health Organization have laid out in their definition of sexual well-being. I'll give everyone a few minutes to read what's on the screen. Okay, this is a needs assessment of men who have sex with men done in 2014. Again, it was marking out for men who have different types of sex, including a lot of what this research was done around anal sex. It's about how to do it safely and how to include pleasure in promoting safe sex messages. So men want and need services where they can build a relationship with staff. That needs assessment has demonstrated throughout its high level engagement that men will talk about sex and relationships when the opportunity is framed positively. So there's research other than this research that shows when clinicians are able to embrace and frame conversations around sexual pleasure in their practice, it does lead to more open conversations about the risks people are taking and about how we can then support them in ways they actually need support. So this kind of research highlights that. A cohort of staff within existing HIV and sexual health services is equipped with the knowledge, skills and interest to deliver excellent care, but clinic staff in large part are not starting the broader conversation around sexual health. I think there's stuff around clinical services in terms of the time they have to do needs assessments in terms of sexual health. If they've got lots of people in the waiting room, they want to get through these conversations quickly so they can help everybody. However, research has shown that when you're starting the conversation from pleasure and you are talking about the sex they're having, whether it's good, the relationships, whether they're healthy relationships, positive relationships, it does put people at ease and opens up a wider conversation, which can highlight things that maybe wouldn't be picked up in a quick consultation. Again, this is the last NatSal study. So it's a study of sexual attitudes and lifestyles within the UK. The last one was done in 2012, which this data shows. However, there's currently data being produced from a coronavirus NatSal edition, and there's a new NatSal 4 study being launched next year. So there will be up-to-date information around sexual attitudes and lifestyles in the UK in the next couple of years. However, the findings from the last study in 2012 echo some of the sentiments we've already highlighted. People are more likely to report relationship breakup, unhappiness in relationships, difficulty in talking about sex with a partner, increased risk of catching STIs, increased risk of having sex against their will, and having general more risk of ill sexual health if they're not happy and they don't know what they want from their good relationships and good sexual experiences. Moving on to education, this is something WAVE works quite heavily in. So this is key messages for young people on healthy relationships and consent. This was published by the Scottish Government last year. It kind of sits in line with the new relationship, sexual health and parenthood curriculum, which was launched by Education Scotland and the Scottish Government last year. And it's about supporting positive messages around sex and relationships and consent in particularly, throughout schools and throughout the education system in Scotland, right from kind of 4 and primary school age right through until the age of 18. There's some examples from the new curriculum here. There's a lot of stuff specifically focused around pleasure in the new curriculum, which is fantastic. Scotland's never had that before, to support teachers who are delivering sex education. If you want to sign up to kind of updates, you can visit this website here, rshp.scot, and you can get updates and see resources that are involved in that curriculum as well. But it really reinforces the need for talking about positive experiences, inclusion, and pleasure throughout the whole curriculum, which is fantastic. There's just a few other examples here. So this one in the middle, the International Technical Guidance on Sexuality Education, it's produced by UNESCO, and it's got some really great stuff in there, which is kind of guidance for the whole of Europe, which is really great. Conduct of relationships and sexual health and parenthood education in schools, that relates to what the new curriculum and the Scottish Government guidance around relationships and consent. And obviously, this is not just about young people. We want to talk about pleasure with service users of all ages. So there's this great research paper around older people in care homes, sex, sexuality, and intimate relationships. It's a really interesting read, no matter what kind of background you're from. It kind of focuses around the idea that a lot of care homes shut down any kind of intimate relationships that start in care homes. However, we should be promoting pleasure and what people enjoy and respecting their human rights throughout life. So it tackles kind of those issues from a nursing perspective as well, which is really fantastic. Okay, I'm going to hand you over to Chris for what we are told about sex.
Thanks, Jo. So I think firstly, we're going to look at what are we told about sex. So that can be from different environments. Can it be from different institutions? Can it be schooling, sexual health clinics themselves, peers, and friends and family? And Jo, could you go to the next one, please? So in the chat box, we have these different age categories. And what we're looking for is if you guys can actually just write a small little thing about what are we told about sex at these different ages and stages in our life. So from primary school, secondary school, when you're going into university or early adulthood, and then during adult life, and as Jo just talked about, retirement and potentially being in a care home situation. So I'll give you 2 or 3 minutes to think about that. And I think the thing in these kind of different life stages is the expectation. Yeah, it's so true. Someone's actually commented straight away at many of those stages, people are told nothing at all. So our kind of attitude towards talking openly about sex is very limited. It's also about expectations on what sort of relationships you should have at these different stages. So of course, in like 5 to 10, you have the whole stranger danger kind of narrative. And then 11 to 16, you've got the scenario around you're starting sexual health education and what that means, and what information you're given. And as Jo's just rightly highlighted, that conversations can start way too late for everyone. And then in adulthood, it's all about procreating and getting on the family. And then when it comes to retirement, it's about no sex. Sex is over. Jo, if you want to click through. Yeah, and Jo's quite highlighted as well that consent is sometimes not given to younger people. So when we're told as younger children that you must kiss grandparents, you must do this, you must express this form of intimacy, even if you're not consenting or open to it. I'm going to click through. There we go. So what are some of the stigmas and barriers for us talking about sex? So this can be religion. So religion can play a massive factor into this, to being actually able to discuss sex in an open and quite frank and honest way. You can have clinical attitudes as a barrier, so assuming that certain identities and certain sexualities will only engage in certain types of sex, which can create a huge barrier to actually engaging in services or understanding sex from your own perspective. You've got upbringing and parental attitudes. So I think a big thing that's important around sexual health education being mandatory in schools is that it can be really different in terms of the information you're given if it's done based completely on a parental basis and expecting parents to pick up and talk about sex. So that can really warp your ideas about discussing it. You've even got judgment from peers and partners, so you can have slut shaming or even people being called frigid. Confidentiality issues, so that could be around your issues where you may know the nurse that you're dealing with, or you're scared that by actually just going into the clinic, people will assume things about yourself. And then the wider societal values that kind of underpin all these different elements, but also make a massive statement about talking about sex in an open and frank way. In addition to this, there's many other influences such as alcohol and drugs, the ability to actually talk about the sex that you want and the sex that you don't want. Again, the language about how we speak about sex, if we use derogatory terms for someone who is quite sexually liberal in terms of their partners, or even using the different languages in terms of sex acts as well, or talking about genitals, can become quite derogatory. You've got peers, what people are actually talking about on social media, the expectations that we put on ourselves from different categories coming in from social media, what celebrities are doing. You could also, if it's Kim Kardashian, talk about celebrity sex tapes and the kind of expectations we put on ourselves from viewing that, the pornography that we watch, the kind of people we see in movies, but also the way music talks about our bodies and about pleasure and about how we can enjoy our bodies and actually have access to consent and ownership. So what is good sex? So this is a little chat box function again. So we're going to go through different scenarios, and then in the chat box you can say whether you think this is good sex or this is bad sex. We won't say bad sex, but we'll say not good sex. So sex with toys. So that can be using them on your own, using them with a partner. What do people think?
Everyone's quiet.
Yeah, we can go through them and then talk about them in different ways as well. So you got sex toys, you got virtual or phone sex, so that can be describing different scenarios or fantasies to your partner over the phone. This could also be accompanied with masturbation as well.
Much more relevant this year during lockdown.
Completely. Sex with condoms as well, so that's using your different layers of protection against HIV, STIs, and pregnancy as well. And how do you make that good sex? Group sex, having sex with multiple partners. Got my chat box in the way. Sex with disability. And got sex under the influence, so that can be under the influence of alcohol or drugs. And how does that impact your ability to have good sex? And sex with a sex worker, so that's either paying for a sex worker and having those conversations about what you enjoy, what you would like to do during this interaction. Anyone got any thoughts on what is good sex out of these scenarios? Joe, any thoughts?
I think something really important to remember is that whatever kind of sex you're having, whether it's on your own or with different people, it's all the same body parts involved. It's all the kind of same sex acts. It's just what's right for you and the situation is right for you. As Rachel has said in the chat box, any of it can be good sex. Communication is definitely key, and it's about how you kind of negotiate yourself into safe and enjoyable situations, whatever kind of sex you're having, definitely.
Absolutely. And I think we'll talk about good sex is about communication, learning what you like, and having consensual sex and good conversations about what you enjoy and what you don't enjoy. Do you want to go through to, so yeah, I think that basically summarizes it. So good sex is about communication between partners. It's about consenting, knowing what you like and what you don't like, having safe sex and what that means for you. And I think the main thing to acknowledge is that sex is different from anybody. People could have what some would consider vanilla sex. People could have very rough sex. But the key thing is that communication and consent is really relevant throughout.
And definitely when we're talking about sex with service users, it's important to know what sex does mean for that individual. For someone, it could just be touching or masturbation. For someone, it could be anal sex. For another person, it could be group sex or chemsex. It's important to understand what they enjoy and their personal preferences in order for them to kind of identify what they don't like and what is not good for them as well.
Absolutely. And it's that basis of thinking about, instead of thinking about what is real sex and what is not real sex, is thinking about what's achievable and what's pleasurable for your service user and what they think is good sex for them. So why should we promote sex positive messages? So I think the key thing is to think of it increases body positivity. It contributes to better and physical and mental health for service users. It boosts their confidence and self-esteem around their body, around their decision-making. It will improve the communication with their partners if they're able to describe things they find pleasurable and things that they think is good sex. They can say what they don't enjoy and what's bad sex for them. It allows them to make safer choices around contraception, their relationships and the sex they have, and that also prevention options as well.
I think a large part of encouraging pleasure is encouraging choice and trying different things. I think a lot of time with contraception, especially, people can end up stuck using a contraception method that doesn't particularly work for them. It has negative side effects for their body. And it's about encouraging service users to try something else, try a different sex position that may not be as difficult or as painful for them. Try using a lube if they're feeling they need extra lubrication during particular sex acts. Try using different contraception if the one they're using isn't working for them. It's all about trying things to find out what is good for you.
In addition, sex positive messages reduce risk of abuse, coercion, intimate partner violence. And it also increases the likelihood that they'll access services more quickly and would need less long-term support.
I think from a service point of view, the more you promote pleasure, and as you can see, leads to the reduce of these risks, it's also going to be much more cost efficient for the Scottish government and the Scottish NHS in the long term, because we're creating a healthier society, basically.
So what opportunities do we get to learn about good sex? Is it from our peers? Is it from different institutions like school? What are people's thoughts about that in the comments box? And me and Joe can throw out some ideas as well. So we're thinking of some start off ones. So the first one would be your doctor or clinician should be talking to you about pleasure. So what's talking about good sex for you? You've got your peers at home. Conversations can start there as well. From pharmacies where you might be getting your prescriptions for contraception. Schools, your partners, sexual health clinics themselves, but also law and kind of society level. So that's where we talk back to policy, actually having it intrinsically mentioned as an achievable goal to make Scotland more an accepting society.
And the police and the criminal justice system have also got a really big part to play in kind of tackling hate crime and making their services more inclusive than they have been in the past. And that really goes a long way to society being more accepting of different identities as well.
And I think peers is quite a big one where you think, particularly from people from LGBT backgrounds, where sex we had was previously excluded from the education we would get in schools. Peer education was a big part of that, of understanding different prevention opportunities, but also different sexual practices and good sexual practices for the community.
Peer education is a really invaluable tool for talking about pleasure. Waverley Care has a peer support group for people living with HIV, and Chris actually delivered this pleasure training to them for the first time last week, and it went down really well. They were really interested in using it as something the group could take forward as well, which was great.
and particularly with populations living with HIV in the 80s and 90s, sex was very much something they were discouraged from, and that's where loads of different kind of opportunities for pleasure came up in terms of BDSM, and different scenes started to come out of ways that weren't just about penetration but were so much more about pleasure and community. So they've got a really interesting learning from them.
Okay, we're going to talk about bodies now. This is a lovely, there's a wall of vagina, but I can't remember the official name for the one with the mixed body parts, but it's by this great artist who plaster cast load of different body parts in order to show diversity, which is great. I'll send out the artist and the link to his website with the evaluation stuff after the session, because it's really interesting bit of work. Okay, so from experience within Waverley Care, and especially from working with young people, we know a lot of young people, or people in general, can't necessarily name or label their sexual organs with the right labels. I think in school we're definitely taught more about the internal anatomy and how babies are conceived and made, rather than talking about external body parts. And we're also taught in a way that's very much scientific around reproduction, and it's not necessarily married up with sexual health and healthy relationships education. So we're gonna give you a few minutes in a minute to see if you can put those labels in the right places, but first let's talk about why we need to talk about bodies. So if someone doesn't know about their body, or feels embarrassed or stigmatized about the body parts that they have, it can leave them feeling ashamed or embarrassed. It can affect their mental health, low body confidence, unable to talk to a partner or anybody else for that matter about bodies. That's really important when something goes wrong, that ability to talk about your body, be comfortable with your body. If you catch an STI, or you have a baby and need to go for kind of scans and stuff, or any kind of checkup, or even thinking about cancers, cervical cancer and kind of testicular cancer, it's very important to be able to pick up those things and go and get support and medical advice as soon as possible. However, if you're not comfortable with your body, that could stop somebody from doing that. Unable to communicate likes or dislikes during sex because you are worried about talking about where you like to be touched or what parts of body you like to be touched on. More likely to make poor choices about safer sex. So if someone is feeling kind of embarrassed about talking about their body, they might be less concerned about using condoms and going with what their partner wants instead of what's best for them. So obviously these are bad enough, but the long-term effects of some of these things can be quite impactful on mental and physical health. If someone's not getting help for something physical like having an STI or having signs of cancer, obviously the long-term effects of that could be much more serious for their physical health. But the risk of poor mental health is something around bodies that is not necessarily talked about as much as it should be across all generations. I think maybe young people are more likely to talk about their bodies than older generations are, and seek help around sexual health and relationships in terms of their bodies. But again, we're back to increased risk of coercion and abuse. If you're unable to communicate about what you like and what you don't like, you're less likely to just stand up for what you do want in a relationship and what you do want from sex. Less likely to access services to support, which again links strongly to increased risk of poor mental or physical health, and more likely to take risks. If we are taught the correct names for our body parts, though, we are more likely to be able to tell a partner where we do and don't like to be touched, so leading to healthier relationships. When we need medical help, we're more likely to go and seek it. We're more likely to report abuse and coercion, and we are there's quite a lot of research in kind of child sexual abuse cases where young people don't know the correct names of their body, so it's really hard to prosecute perpetrators because it's not clear cut exactly what has happened to the victim if they're unable to communicate where they were touched, what exactly happened to them, what sex acts were performed or were not performed, because they just don't have the confidence or the right words to express what exactly happened. So that's really important. Okay, so can you put these words here in the right place on this penis diagram? Give everyone a few minutes to think about it. Okay, so the penis shaft is probably the easiest one. It's the shaft of the penis. The glans is in the tip of the penis. It's where all the sensitive nerve endings are. It's where you're most likely to experience pleasure during sex in a penis. Foreskin, this penis has a foreskin. Obviously, some penises have been circumcised, which is when the foreskin is removed for either medical reasons or for cultural or religious reasons. The scrotum is where the testicles are, and the urethral opening is just where somebody pees from. The perineum is the area between the anus and the testicles, and it also can be an erogenous zone as well. So a lot of people like that area stimulated during sex. Oh, Chris, this is why it took so long, because I'd highlighted them to do individually.
This now makes sense.
Okay, so the answer has come up because I've clicked too fast, but these are all cast from real penises. And as you can see, the one circled here is actually a penis of a trans man following phalloplasty surgery. So it's pretty hard to tell. I couldn't tell at first when I saw this slide. It's amazing how much surgery can do. But it's, again, this slide we've just put in to make people aware that you should be aware of trans bodies and trans body parts when you're talking about bodies, to make it as inclusive as possible. Okay, on to vaginas and female anatomy. So again, I'll give you a minute or two to put these labels in the right place. Okay, did everyone get them right? So the overall word for the external female anatomy is the vulva. I speak about this with young people quite a lot. It's my favorite kind of sexual health topic to talk about young people with, and vulvos come up quite a lot. And I tell them, obviously, that's quite a big mistake to make. Don't go to a car garage and ask for a vulva. It could be quite embarrassing later in life if you do that. Mons pubis is kind of a fatty cushion at the front of the pubic bone, which just protects everything behind it. It's where pubic hair grows. It's just there to protect internal organs, basically. The clitoris, a lot of people have heard about, but they maybe don't know much about. It's often described in sex education as a pea-sized organ at the front of the vulva. However, it's actually quite a big organ which goes internally into the body as well. It's kind of, I've got a knitted one, I'll go and get it in a minute when Chris is doing his bit so we can show you at the break, but it's actually shaped a bit like this. This is the bit you see at the front of the vulva, and there's kind of two prongs that come down internally either side of the vaginal opening. And it's an organ purely for pleasure. It helps kind of stimulate the female reproductive organs to produce natural lubrication to make sex easier. Labia majora and labia minora. The labia majora are the outer lips and the labia minora are the inner lips. Urethral opening, again, it's just where someone pees from. And the vagina is actually the passageway between the outside of the body and the uterus, where a baby would grow if someone was pregnant. So it's the passageway linking the internal reproductive organs and the outside of the organs. So it's where a penis might go during sex, or a finger or a sex toy. It's where a baby would exit the body during natural childbirth, and it's where a tampon or kind of sanitary products might sit during someone's menstrual cycle. I've got to like not click too far here, else it will give away the answers for the next slide again. Okay, so which of these vulvas, again cast from real people, do you think belongs to a trans woman 2 years post-surgery? Also, the woman who makes these casts, she makes great kind of body positive sex education resources. The website is Positive Sex Ed down here, and it's a really useful tool. It's based abroad, and the resources are quite expensive if anyone's thinking of buying them, but they are really good. It's a really great website to visit. Okay, let's do the answers. So this one is the vulva post vaginoplasty, 2 years post. As you can see, it doesn't look much different or any different at all to any of the other vulvas cast here. There's also one other vulva which is slightly different. So this green one here is 7 years of taking testosterone, leading maybe possibly towards trans surgery, or just because there's a need for them to take testosterone. I don't know the personal story behind it. However, again, you can see there's not much difference. I've skipped a slide there. Obviously, there's lots of other erogenous zones of the body. People like being touched in different places. Breasts and chests and nipples can be a great way to start off conversations before leading to penises or vulvas with young people. In terms of staying safe, obviously a great way to start that conversation is around checking for breast cancer in anybody, male, female, however they identify. Everyone should check for breast cancer and know how to do that, but that can also lead to conversations around pleasure and where people like to be touched. Anuses, again, lots of people like to be touched or have anal sex. The anus is actually full of nerve endings. I think, don't quote me on this, but I'm pretty sure it's the second part of the body with the most nerve endings in. So it's very likely to stimulate pleasurable sensations if stimulated. However, it's not for everybody. It can be painful, and there are some increased risk of catching STIs and causing damage with anal sex. So it's again about using every opportunity to talk about bodies, to talk about the risks associated with sex, how to do it safely, and how to promote pleasure with those body parts and stimulating those body parts. This diagram here is meant to represent pubic hair. I'm sure you all got that from the squiggles on the page. I just put this in here because it's really important to think about how influences we were talking about earlier can impact on our bodies. So especially the porn industry has hugely impacted on our pubic hair habits as globally, not just as a nation, but globally. Obviously, it's promoting choice again, it's promoting personal preference. Some people like pubic hair, some people don't, but it's again the safety messages around them, around shaving and getting rid of pubic hair, which can help more pleasurable experiences. People are much more likely to enjoy their bodies and be confident if they've shaved safely to get rid of their pubic hair and they've not got a nasty rash, or they're worried they have an STI because they've got a shaving bump or something like that. It's also important to know that the brain is one of the most sexual organs we have. So it kind of processes our feelings, our emotions, our what we want to do, what we don't want to do. It brings back memories and stores memories and shapes our experiences based on former memories. So if we've had a bad experience before, it may be a barrier to pleasurable sexual experiences or healthy relationships in the future. You can kind of retrain your brain around these things, but it's important to know the brain plays a really important part in how your body responds during sex, and helps you form and make decisions around safe sex choices as well. Without the brain, it kind of processes our five senses: our touch, our smell, our scent, our what we hear, noises during sex. So it really adds to the sexual experience and heightens that as well. I haven't got any more slides on bodies, but I just wanted to touch on briefly some of the things around bodies that might really kind of hinder someone's sexual experience and sexual pleasure. So obviously with penises and vulvas, you can experience things like erectile dysfunction and vaginal dryness. These aren't necessarily things that are taught about in sex education or talked about in general, unless someone's really experiencing a problem and goes to their doctor about. However, they are a natural part of life. They can be dictated by the brain and other parts of the body as well, in terms of how stress impacts on our body and our sexual experiences. How tired we are impacts on our sexual experiences. I think there's stuff around, there was an article on BBC News website the other day around people paying for surgery to restore their virginity and around hymens and stuff. It's a load of nonsense. There's this kind of ingrained cultural belief that once a hymen is broken inside of a vagina, it means that someone's not a virgin anymore. So the hymen is actually a very thin mucous membrane, which can be broken at any time in someone's life through sport or kind of physical activity or for other reasons. Some people might have had a reason for kind of a smear test or an examination before having sex, which might have also led to the hymen being broken. So it's important to challenge those cultural stereotypes around virginity, definitely as well, in terms of our bodies and how we see them and how confident we are. It also kind of protects us against FGM, female genital mutilation, and kind of really abusive things like that, because the more people that are aware of that, the more it's going to be challenged within our society and seen as something people should protect their relatives and their friends and their partners against as well. Okay, Chris, back over to you.
So I'm going to be talking about sexual identities and identities in general in relation to sexual pleasure. So of course, SX does work with gay and bisexual men and all men who have sex with men. That is inclusive of trans men. So we have to be mindful of that when we're talking to people about body parts, different things that are achievable for different people, and also pleasure as well. But also we help out in loads of different LGBT spaces and also keep on top of different terminology and also different terms and uses that I'll go into in a minute. I'm going to click on Joe. So to start off, there's a few distinctions. So when we talk about someone's sexual orientation, we're referring to a person's attraction to other people. This could be a romantic, physical, or sexual attraction, or it could be all three. It's just that they can be formed differently, and someone could have a physical attraction to someone and have a romantic attraction to someone else. And that's when you get kind of different terms under this umbrella term of sexual orientation. In addition, there's gender identity. So that's a person's sense of their own gender, which may or may not align with the sex they're assigned at birth. So that's where you get the definition of transgender. So that means someone who identifies as a gender that is different to the one they were assigned at birth. And then cisgender means that someone identifies with the gender that they were given at birth. And on top of this, there's also gender expression, which is how a person expresses their gender outwardly to the world. So that could be in terms of someone being quite feminine in their dress and attire or their presentation. They could be quite masculine, or you could even have androgynous as well. So the World Health Organization's definition of sexuality, so it's an essential aspect of being human throughout life. It encompasses sex, gender identities and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. So a sexuality is experienced and expressed in thoughts, fantasies, desires, beliefs, attitudes, values, behaviors, practices, roles, and relationships. And I think the key thing is it's influenced by multitude of different avenues. There's no one distinctive way that sexuality can be influenced. It can be very different culturally, it can be very different due to religious backgrounds, but it can also be linked to different social and economic factors as well. So this is a little game that we have. So these are different terms and definitions. So have a look at the terms which are on yellow and the definitions on the green, and think of what the matches are. And then in a few slides, we'll go back and match them all up so we can be certain about the kind of terminology that we're using. So I'll give you a few minutes. And the other thing to say is this isn't all the terminology. The one thing I would say when looking at terminology, Stonewall has a very good A to Z of different terminology when it comes to LGBTQ identities and culture. Joe, do you want to move on? So talking about trans identities, so trans is actually an umbrella term for those whose gender or identity or expression differs in some way to the gender that was assigned to them at birth. So trans women will be someone who was assigned male at birth and has transitioned to live as a woman. Trans men is female to male, cross-dressing, and then non-binary identities, which is also its own umbrella because it also encompasses people who would identify as genderqueer, or someone who would identify as pangender, and kind of these two that exist out of the binary position of male and female. And they can use different pronouns such as they and them. So the key thing is to be respectful of someone's pronouns. So this is the terminology. There is two things that are the wrong way around, but I'll bring that up in a second. So trans man is someone who is born with female sex organs but identifies as male. Trans woman, born with male sex organs and identifies as female. And then the key thing around trans identities is that transitioning can mean a multitude of things to different people for them to be comfortable in their identity and their gender identity. So it could mean surgery for some people, it could mean hormone use for some people, but for others it could be quite straightforward in terms of social transitioning, in terms of people changing their name, their pronouns, their attire, or the way they wish to be addressed, or the spaces that they use, such as different toilets and things. Intersex, so this is a person who's born with a variation of sexual anatomy that's neither male or female or somewhere in between. And this isn't always based on genitals. This can also be down to hormones as well. Non-binary doesn't identify as a particular gender. They exist out of those binary positions of male and female and may use pronouns they, them. Pansexual, the attraction is not really based on someone's gender, but on the person themselves. Questioning is when someone's still trying to explore or identify different things about their identity or the kind of relationships they want to form, and they don't really identify with any particular labels. Gay identifies as male, attracted to other men, and also some women will use this term as well. And lesbian identifies as female and attracted to females. So this is the flip. So asexual is someone who does not feel sexual attraction, and bisexual is someone who's attracted to both sexes or opposite sexes as well, same sex or opposite sex partners.
And the mistake was entirely my fault, nothing to do with Chris.
So one thing we want to talk about in relation to LGBT populations and pleasure is intimate partner violence. So one thing to be clear around this is that there is actually a lack of recognition of abuse within LGBT communities for a variety of reasons. So quite commonly, domestic abuse is framed as violence that is done against women by men, but it can also be done from same-sex partners, and it also can be a barrier for men to report because there is an assumption that people who are a victim of these crimes will be women and they've struggled to report this. There's a lack of visibility for LGBT relationships or domestic abuse within sexual health education in schools. So even talking about how LGBT relationships may differ from heterosexual relationships. And there's also quite a lot of negative portrayals around same-sex relationships and trans identities in the media. The thing as well about intimate partner violence and why we use that term is intimate partner violence is a form of domestic abuse. We're just differentiating it that it's not between a family member to a child, it's from a partner to another partner.
In terms of the way as a country we maybe think about abuse, in domestic abuse is very often framed as violence against women, as the slide says. So kind of tackling these issues around abuse within non-heteronormative relationships is really important in terms of promoting pleasure within those relationships and letting kind of the stigma around those relationships dissipate a little bit as well.
And the thing is as well is particularly one thing, LGBT Youth did quite a lot of good work on this, and they interestingly found that regardless of when someone came out, they tended to go out in their first initial relationships with someone who was much more well established on the LGBT scene, if that's the term. And it was more to do with that kind of integration into a community, having someone who could kind of show you the different ways relationships are formed or the different friendships that can be made. And there was very much a power dynamic that happened in that situation, which you wouldn't see reflected in heterosexual relationships. So I think around IPV as well, it's important that we don't really fully understand intimate partner violence between same-sex couples yet, so we can't really identify it fully yet. So around sexuality in Britain, so the LGBT health report done by Stonewall found that almost 1 in 4 of LGBT people had witnessed discrimination within a healthcare setting. There was 1 in 20 LGBT people were pressured to access a service to question or change their sexual orientation when they access the service. And then another one that was quite interesting is that 14% or 1 in 7 LGBT people had avoided treatment for fear of discrimination because they were LGBT. So there's examples with service users who either through their own experiences or experiences of their peers have decided to stay away from different services because of the way they talked about the sex that they had in kind of derogatory or judgmental fashion, or the way that they constantly portrayed their sexuality as a risk in relation to sexual health. So I worked with one guy who, when he was going to his GP about mental health, the GP insisted again and again that he go for a HIV test as opposed to talk about his mental health and how he was experiencing discrimination in work. So this information came from our own study, which is There Needs to Be Care Throughout, which explored the experiences of non-binary people, trans men and trans women, access to sexual health services in Scotland. So this was a really useful tool to actually capturing what was going on in this community for Scotland right now. Obviously, one caveat is this was done before COVID, so we would need to kind of look at more information now. But there was key things and key learning that the community members that took part wanted practitioners to know. So a key one was to check their name and pronoun at the start of appointment, because it was a sense of recognition or acknowledgement of their experience, but also validating them and their identities. And key thing was to not make assumptions about their gender of their sexual partners or the kind of sex they had in relation to their own identity. So this quite commonly happens with gay men, that the assumption is you're a gay man, you'll have anal sex, therefore we need to talk to you about anal sex risks. But the man might not engage in anal sex, but the assumption's already been made. They also wanted practitioners to have a willingness to go out and find information that they didn't know, rather than expecting the trans individual in front of them to educate them on the experiences of an entire community, which they found very labor intensive and very exhausting. And when they were talking about a lack of tailored information available to this community, it was especially the case for risk factors or prevention options when it was in reference to anatomy. So they would refer that things were spoken in terms of the kind of genitalia that they had or the kind of risks they were having rather than their identity. And I think, as Joe alluded to earlier, that body parts are such a big part of talking about pleasure. Several of the participants explained that the experience of talking about body parts or physical examination could be difficult and could induce feelings of dysphoria. So it's really key that you think about your kind of audience when you're discussing these topics as well.
I think it's really important to highlight as well that we're talking about LGBT terminology here, but all communities have their own kind of identities and terminology that they use within their communities as well. And as professionals, it's really important we kind of meet them where they are in terms of the words they're using for bodies, for sex, for relationships, but also making sure that they have the understanding around the words they're using as well. For example, a lot of young people use slang, like dicks and fannies and things like that. But from a very young age, do they really understand the body parts and the anatomy they're talking about? The same goes for sex acts. A lot of young people use kind of sex acts or body parts as insults for one another, but it's, again, making sure they have the understanding behind the language they're using in order to protect them and keep them safe, basically.
Yeah. So from that report, there was 4 key points that people wanted to raise, which was with practitioners. So when working with community members, ask patients for their name and pronouns as just part of a routine inquiry. So a good way of also capturing data around trans individuals is, so your first tick box would be like, do you identify as male, female? And then you've got other identities like non-binary. And then the second question would be like, is your gender identity the same as you were assigned at birth? And that kind of is a much more open and honest way of asking that question without making people out themselves as trans. So the other one is don't make assumptions about someone's identity, body, or sexual activity. Again, relating back to men we've worked with, don't assume because someone's a gay man that they instantly engage in anal sex. Be aware of different communities' terminology and talk about risk and prevention in reference to anatomy rather than genders or bodies. Yeah. And then in addition to this, there's some great LGBT resources that you can find. So Essex Scotland has a whole resources page that you can look into. LGBT Youth, who I mentioned earlier, Stonewall, LGBT Health, Equality Network, and the Thai campaign have great resources for young people as well.
Okay, I'll leave those resources up. And if everyone wants to take 10 minutes and come back at 20 to 12, go and grab a cuppa. flat is freezing. I'll give everyone another minute to come back. But
I was too ambitious with how much I filled up my mug with coffee, and now it's a very delicate operation when transferring it.
okay, it's 22 by my clock, so let's get going again. So the second half of the training, we're going to talk a little bit about how we, both Chris and I as practitioners and other services we work for, incorporate pleasure in what we do, to give people some ideas for their own practice. And then we're going to talk about specific ways anybody could include talking about sexual pleasure with their service users after that. So first up is WAVE. As I said at the start, WAVE is a sexual health and relationships service for under 25s. It covers Highland and Argyll and Bute at this point in time. And we do a lot of work directly with young people, but also training for professionals as well. So first things first, we're really, really proud as a service that a lot of our work is shaped directly from young people. So when we were putting together the service, we had young people involved in everything from designing our logo to what went on the website to creating content for our education programs. And this is some feedback from young people about what they wanted and some kind of quotes from young people about their experiences to that point in time. So obviously you can see there's a lot of learning online from things like porn, not really being, there was a lot of feedback around not having trusted sources online in terms of what they were seeing being safe. They just weren't taught or comfortable talking about the things like porn, pleasure, masturbation, abortion, all the stuff that is really, really important in people's lives, but we tend to shy away from as a society when talking about sex and relationships. Unfortunately, sex education is not yet mandatory in Scotland. It has just become mandatory in England, but we haven't made that decision as a country yet. And until that point, there is still a lot of work that needs to be done in schools to kind of make sexual health and relationships not such a taboo subject in terms of being delivered at all, but also so teachers feel comfortable and able to deliver it without any backlash from the communities they work in as well. I think there's not enough support for the staff delivering these topics, as well as not enough support for the young people. As you can see, still, even though pleasure isn't talked about a lot in schools, and young people might not even necessarily always know what sexual pleasure is if they haven't yet become sexually active or had any sexual experiences, still over 50% of the young people who took part in the survey indicated that pleasure was important for young people to learn about. Healthy relationships, body parts, all of the things we've talked about today were included in that survey, and there was no topic that was under 50% of young people. And just so you know, there was 1,195 young people included in this survey, so a significant kind of population sample for the Highland area. Why we talk about young people, pleasure with young people? Well, for all the reasons we've already talked about. It's an essential part of keeping young people safe if they're understanding around sex and their understanding around their bodies and their understanding around healthy relationships and consent and the law around sex and what they can and can't do at different ages. If they know all that and have that knowledge in place, it's much likely to keep them safe, and they're able to keep themselves safe as well as us as professionals keeping them safe, because they're able to identify what's healthy, what's normal, and when they need to go and get support. Helps normalise their sexual health and encourages access to services. The more young people know about the services available to them, and they're comfortable talking about sex. Even though the law says you can't have sex till you're 16, it's important to normalise access to services so that the young people that are having sex and are putting themselves at risk can get the help they need if and when they need that support. It protects young people within their relationships. We've already talked about that a little bit, able to kind of identify healthy relationships, what's normal, what they want from a partner. It's so that when they are in a situation with a partner that they don't necessarily want or they're not happy with, they are more able to identify that that's not right for them and change that situation. And it helps young people understand what they really want and enjoy. Quite a large percentage of the population has sex and has sex regularly throughout their lifetime. So if we teach young people at an early age to only have the sex they want and only have the sex that they're enjoying, they're much likely to have good sexual well-being for the rest of their lives. So how we talk about pleasure with young people, we do talk about sex and sex acts, and young people like to ask you lots of tricky questions about particular things they've seen online. It's about encouraging questions, being open as a practitioner and willing to have those conversations, and being honest as well. Just because someone's under 16 and shouldn't legally be having sex, it doesn't mean they are having sex if they're asking these questions. It just means they're preparing themselves to have sex or to become in a relationship or to move forward with kind of their sexual identity and what the choices they're making around who they are as a person as well. So the condoms represent choice. We really encourage choice. Condoms, try different condoms, find ones that work for you and your partner. Try different contraception, try different sex positions if the ones you're having aren't enjoyable or are maybe slightly painful. Try lube, try sex toys. We really encourage, not encourage, that's maybe the wrong word. We really, encourage is the right word. We really encourage conversations around masturbation and self-pleasure and using sex toys in the sex education we deliver to young people, because it's a really good way of finding out what you like in terms of sex and different sex acts, where you like to be touched, where you don't like to be touched. But it's also a really good way for young people to get to know their bodies, become more comfortable with their sexual organs. And the more comfortable young people are with their bodies, the more likely they are to, again, access services if something is wrong or there's anything out of the ordinary, or they just need to talk if they're worried about STIs or cancer or anything else. We get young people involved. Young people, like I said a short while ago, have been involved in the design of all WAVE services, including the content that goes into the education we deliver in schools and youth groups and online. We make sure all our education sessions are underpinned by inclusive messages around relationships. We don't gender sex, we don't gender bodies. All our scenarios have gender neutral names and a non kind of heteronormative where possible. We include like sex positive messages. Sex is good, it's meant to be a good thing. Why don't we come from a positive place instead of starting with don't have sex, you get an STI, sex is bad? We don't take that approach at all. And scare tactics, a lot of sex education historically has used scare tactics like showing really bad pictures of STIs and things like that. Research has shown scare tactics to be very they don't work, basically. They're ineffective. All young people do is have nightmares and worry themselves to death about things that they think they might have seen in pictures, and they start Googling. And it's about encouraging positive sources of information that they can rely on and trust, and encouraging them to be open and honest with any problems that they might be having. This kind of green icon in the middle here with the holding hands and the words, this is to represent working with partners to encourage these conversations. So this is from a poster we did with some students in a school, in an academy, but we worked with Police Scotland and a few rape crisis agencies to work with these young people over a whole day. And we decided to reframe the conversation around, well, abuse is bad, we need to report it, this is what you have to do to creating these positive posters around this is what a good relationship looks like, this is what a loving relationship looks like, this is what a healthy partnership looks like. And the young people themselves chose to do that, to frame it in a positive way to encourage and support other young people as well, which was great. We deliver professional training like this, and we like to get young people involved in running their own projects. So top right is a little condom wallet with some artwork promoting healthy disabled relationships, which some young people with additional support needs created the artwork to go on the condom wallets. And we worked with Passante to create them and put them out into the world. So that was a really, really great project. But if you head to the Wave website, which is at the end of this presentation, you'll see some examples of how we've got young people involved in that as well. And I will hand you over to Chris.
Back to me. So I'm going to talk about how SX uses positive sexual approach to talking to our guys in our community to make sure people don't feel judged about the sex that they have, the relationships that they form, and make sure that they have access to the information that they need to live a happy and healthy life. So how and why do we talk about pleasure in our practice? So the way we do it quite commonly is we run a clinic in partnership with the NHS in Edinburgh. And as part of that, we do something called a brief intervention. And that's kind of an opportunity for us to talk about prevention options, talk about mental health, stigmas and prejudice and things going on in lives. But also we ask people the simple question, are you enjoying the sex that you have? And what that does is open up a conversation to say, we're here to talk about sexual pleasure. And quite commonly what we find is when someone's having an issue with, say, condoms, issue with the relationship, or perhaps prevention options like PrEP, it's down to the fact that they aren't enjoying the sex that they have, or there may be something going on in terms of a mental health thing, leading them to make decisions that they ultimately don't want to do. And when talking about sex should be pleasurable, how sex should be pleasurable enables those conversations about risk and consent. So when talking about how relationships should really be positive and should be beneficial for you, that enables us to talk about risks that people may be putting themselves in, and also the fact that they may be having sex without consent. And we also have made a link between that prevention methods actually reduce anxiety around sex and could also increase feelings of intimacy and pleasure when it comes to the sex lives of the men we work with. So this is just a little case study about what talking about sexual pleasure means for a service user. So there was a gentleman we were working with who was putting himself at risk through lots of condomless sex. And he basically came to us at SX deciding that he needed to go on PrEP and that would be his solution. So he wouldn't be picking up STIs and he wouldn't actually potentially be contracting HIV, because he was finding condoms really hard to use. So we talked to him about condom use, but he thought PrEP would just cover him for HIV. So he was like, that's the big one I'm worried about. In reality, the conversations seemed to link that he actually had very low confidence around his body and his self-esteem. And what he was doing was engaging with guys because he felt validated by this experience of having sex, but he genuinely didn't feel like he could consent fully, or he didn't really want to engage in that sort of sex, but felt like it was validating him and giving him a little mental health boost every now and again. So when we spoke to him about self-pleasure and exploring what felt good for him. So we looked a lot at sex toys, the good sex guide that we have on the SX website, and how to inform someone about what feels good and how to keep consent active throughout the conversation. And through this conversation, his body and confidence improved, and he understands how he enjoys sex now, which is really important. And now what this has kind of opened up to is he's now able to form a bit more nuanced relationships with guys online and talk more openly about what he enjoys and what he doesn't enjoy. And that's given him a lot more confidence. And at the bottom is just a little quote from him that he still thought sex was always meant to be painful, but now he realizes he was going about it all wrong. And a bit of research from a gay perspective of what sexual pleasure means for us. So this was a study done in the States, which is called PrEP and Pleasure. Pleasure seeking plays a role in prevention. So what they found was that pleasure can be a really important factor in the decision makings of prevention. So if someone feels that this prevention option is going to offer them more intimacy, more pleasure, that will be taken into account when they make these decisions around HIV and STI prevention. The key thing was that they highlighted a need for more research to be done, especially around how service users manage pleasure seeking and its impact on their sexuality. And when pleasure and intimacy come into a consideration about taking PrEP or combining it as part of an ongoing prevention care. And more specifically, we need more greater knowledge about how sexual pleasure seeking affects the decisions that we have when we come to talk about our sex life and the relationships that we build.
Okay, so there's some examples of how we include pleasure, but we have some other tips and tricks up our sleeve. So these are a few scenarios I'm going to leave on the screen a few minutes. I just want you to pick one or pick a couple and think how talking about pleasure might benefit that person within their lives. We won't talk about them all, but we'll pick a couple. So I think Sam in the bottom left is quite a common scenario for people we work with. Someone who thinks that condoms reduce sensation and sex won't be as good if they use condoms. One of the messages all our services promote is that there are so many varieties of condoms out there on the market now that has Sam actually tried a few different types, find out which ones work for them and their partner. Sam might have only used the same type of condom that he was given by a school nurse in school and never experimented with other types. You can get condoms that are different shapes and sizes. It's really important to find ones that fit properly. You can get ones that are ultra thin, ones that have lube that heats you up and cools you down and creates all these different sensations, ones that are ribbed and dotted, especially to enhance pleasure. So it's about experimenting, and it's about the way that condoms are seen in the partnership as well, and encouraging condoms to be seen in a different way, to be part of foreplay. Maybe Sam's partner might put the condom on Sam, or vice versa. So it's encouraging safer sex to be part of a pleasurable sexual experience. Amy in the middle at the top is 6. We kind of highlighted this earlier. There's kind of little taught to young children about consent and that they have the right to consent as well. Consent is often dictated to young people. So another child at school put their hand inside Amy's skirt and inside her underwear. Amy didn't like it, but didn't say stop. Probably because a lot of young children are told that their private parts are their private parts. So Amy might have felt like she would get in trouble if she reported this to the teacher, or is simply too embarrassed to talk about her private parts, because again, we don't really teach children 6 or under about their sexual organs. We teach them the head, shoulders, knees and toes, but we don't teach them anything about the organs that they have in terms of reproduction and sexual health. It's still body parts at the end of the day. They still need to be able to look after them and keep them healthy. So talking about consent, and it didn't feel good. So why didn't it feel good? It wasn't a pleasurable experience. If you're not having a pleasurable experience, what could you do to make sure you're not in that situation again, and Amy's not at risk of feeling embarrassed and possibly feeling upset after that experience? And again, it's about teaching young children they have the right to say no if they don't like something, and to withdraw their consent or not give their consent. Brody up in the top left, I'll touch on lastly. He identifies as a trans man, but is worried that his clinician is going to make assumptions about the type of sex he has. Possibly the doctor might also be making assumptions about the body parts Brody has and how Brody interacts with his body in order to create sexual pleasure in the relationships and types of sex he's having, whether that's with a partner or on his own as well. If Brody's worried about becoming pregnant, if you're worried about anything during sex, whether it's pregnancy, whether it's STIs, whether it's pain or anything like that, the more anxious you are or worried about sex, the more it's going to reduce the amount of pleasure you experience during sex, and the way your body responds to sex as well, if you're too busy thinking about it rather than enjoying the experience. So it's about maybe some education for his GP that could help open up those conversations with people like Brody who are attending the clinic, but also about reassuring Brody that the GP is there to help them and they can stand up for themselves in terms of their own needs and their own rights as well. Okay. Education is key. Obviously, from a service that provides sex education, I'm always going to rant about sex education. We have the new RSHPE curriculum in place to support people delivering sex education in schools, but also in youth groups and community settings. Anyone can download and use those resources, and it's the rshp.scot website to sign up to that. This is an example from the International Technical Guidance on Sexuality Education produced by UNESCO. Again, as you can see, similar to the RSHPE learning resources, their learning objectives are set out into age and stage, and they do include pleasure and what's normal and what should be normalized within that education within schools. So as you can see, learning objectives age 9 to 12, human beings are born with the capacity to enjoy their sexuality throughout their life, and it's about creating lesson plans and learning opportunities for young people through to kind of back up those messages. However, education doesn't just happen at school. We all leave school probably not knowing half as much about sex and relationships as we should do in order to keep us remotely safe. So it's about thinking about the service users you work with and how you could use education as a prevention tool to kind of shape some of these conversations around pleasure, whether it's with gay men like Chris works with, and as he said earlier, they do talk about pleasure very specifically, but it's whether you're a medical professional talking about contraception and you use it as an opportunity to bring up, well, is the sex you're having good? Does your contraception add to the experience because you know you're safe, so you're more relaxed, or does it hinder because you're getting side effects? And using anything you're talking about to introduce pleasure. I think if we don't create spaces to talk about pleasure, we're not giving people opportunities to think about whether they are enjoying the sex they're having and whether it could be better and what they need to do to make it better. Be sex positive. I think this is fairly self-explanatory. We've talked lots about talking about sex can be difficult for professionals, but it does help if you are comfortable talking about sex. But if you're talking about bodies and kind of sexual identities, genders, all of these things contribute to sex being a more positive experience for someone, because the more comfortable you are with these topics, the more you're going to relax and enjoy the relationships that you're having. Encourage new things, different sex positions, sex toys, trying different environments, maybe the shower or the bath instead of just the bedroom, making your environment as relaxing as possible. I know some people prefer kind of dimmed lights and candles, and really setting the mood and putting as much effort into setting the mood as the actual sexual experience itself, so that they can relax and enjoy themselves. Talk about pressures. I think it's really important that if someone comes to you and has a very negative attitude towards something in terms of their sex and relationships, it's about finding out where that pressure is coming from, why they think like that, and challenging that. So the International Planned Parenthood Federation says sex positivity is an attitude that celebrates sexuality as an enhancing part of life that brings happiness, energy, and celebration. Sex positive approaches strive to achieve ideal experiences rather than solely working to prevent negative experiences. So again, not just coming in with, well, STIs are bad, don't have sex, because you might get one. At the same time, sex-positive approaches acknowledge and tackle the various concerns and risks associated with sexuality without reinforcing fear, shame, or taboo of young people's sexuality and gender. So again, it's something that's all-encompassing. Sex positivity is about the whole package. It's not just about a certain sex act or contraception. It's about, again, back to that holistic approach to sexual well-being. And I think this last point about the types of sex people are having, whether it's a young person or a 95-year-old person, you shouldn't make assumptions whether they're having casual sex or they're in a monogamous relationship or they're having different kinds of sex with different people at different times. People's preferences change over their lives, and it's important to take that into consideration, but it's important to not make those assumptions and actually ask people what kind of sex they're having as well.
One thing I'd say quickly on the last bit, just around, and the massive fire truck going past, is if you're unsure about different types of sex act or different kind of relationship setups in terms of polyamory, things like that, there are really good resources online, particularly around sex. And MSM, come and look at the SX website, because we have a fantastic resource on a risk tool which takes a sex positive approach to talking about prevention, but also a good sex guide which is solely focused on pleasure, which is available for both cisgendered gay men and transgendered gay men as well.
I think a mistake we fall into when we make assumptions about the types of sex people are having is, again, Chris was talking a while ago about the assumption that all gay men have anal sex. Well, if you're making that assumption, it's, as a clinician in particular or a medical professional, you're maybe not making a very good choice about what kind of testing or treatment they need if they do need STI support. So it's, again, what kind of sex they're having and what kind of partners they're sleeping with does help determine risk and possible treatment and testing options as well. So that is very important to physical health. Okay, start with pleasure. I think it's really important that pleasure is a whole organisation topic. It's not just you as a sole practitioner. It should be embedded in your practice. You can open conversations with pleasure. It could also help identify health problems if you're comfortable and happy talking about your body parts and what's good and what's not good. For example, if someone with a vagina is having painful sex, it could help identify a risk of cervical cancer or vaginal dryness, and then that clinician or that professional can help resolve that solution. So conversations about sex can help resolve some of these issues people are having around sex as well. In policy and planning, so I've put a little example here. The FPA kind of dissolved a couple of years ago, actually, but it was the Family Planning Association, and they still sell really good resources and leaflets and stuff on their website, so you can still buy their resources and access their resources. But they had a sexual pleasure and wellbeing policy which sat alongside all their other policies and was really ingrained in everything they did. And it's a really good kind of activity, even if you're not going to embed it within your practice, to maybe think about how the work you are doing in terms of your policies and strategies are kind of reframed in a more positive way and come from a more positive place instead of just focusing on the negatives. And in teams, make sure everyone's being inclusive, make sure everyone's on the same page and giving the same messages, else it really can be conflicting to service users who are working with a variety of your colleagues. Okay, I think this is something that's not necessarily embedded in practice as much, but think about our own values. I work with young people directly, and I'm very lucky that I don't have any children to cause any conflicting scenarios, but I do know professionals that have their own children who would definitely tell their own children different messages from what they would tell their service users. And I think it's okay to adapt your messages to your audience, but it's about being consistent, about being self-critical, whether your attitudes are influencing your work in a negative way, just because you wouldn't like your own son or daughter to go and have underage sex. That doesn't mean that should influence the support you give young people that possibly are having underage sex and do need that support. Making time for reflective practice. I'm very keen to push reflective practice at every opportunity. I think it's really important as professionals that we're very critical of our own practice and constantly look for ways to kind of update and improve our practice. So reflective practice, making space for that does help kind of identify gaps in training or resources that your service could use to support, kind of including things like pleasure, and updating your practice to kind of changing service user needs as well. Be proactive. Like I said, take every opportunity to talk about pleasure you can. No matter what you're talking about, you can talk about pleasure in some way. I think this middle point here allows service users to test you. We get tested all the time. We get questions about anal fisting and things like this from 14-year-olds, and it's purely a way to see how we're going to react to those questions, whether we're going to shut them down or whether actually we're here to support them and we're serious about supporting them and they can trust us and have those conversations with us. So if something comes up that can test you and challenge you, it's usually for a reason, and it's about exploring why people are asking that question and whether they do just want to test whether they can trust you rather than what answer you're going to give them. Be human is really important as well. Use humor, use your own personality. We're not robots. Service users engage very strongly with people that come across as human, that aren't there judging them, that have, all humans have flaws, and I think lived experience can contribute a huge amount to the way we work with service users as well. This was a research paper framing sexual health research, and it talked a lot about sexual health, but I picked this one to put on because the bottom line, interventions that safeguard pleasure are much more likely to work than those that do not. So be aware of that, talk about things in a positive way. If you're not there judging and barreling in with all the negatives, people are much likely to not shut down and be open to having the conversation. So keep that in mind. Promoting pleasure within your environment. I think this is something we've been particularly aware of as Waverley Care staff over the last few months. We've all been working from home. It's very different to having your perfect office environment set up with kind of inclusive posters and stuff in the background. So it's about making your space inclusive and supportive and friendly and free from distraction. Time and pace is also really important. It's not about the physical environment, but it's about the environment you're creating for your service users. Be inclusive. We've talked over and over again about kind of don't stereotype genders or bodies, be aware of different identities, be aware of sex acts and don't gender sex acts. Anal sex is not just for gay men. Vaginal sex is not just for straight women. Avoid clinical terminology and jargon. I think we've talked a little bit earlier about using words that service users know and use, but also making sure that understanding is there as well. This kind of point about be aware of your body language. I've been aware that I'm sat here shivering because my flat is freezing throughout this whole training, so it does make a difference how you come across, especially via Zoom when someone's not face to face and can't see how you're reacting to things, or if there's maybe a delay in kind of the connection or something. That can be really important. And as this quote says, this is from the Council of Europe in kind of a document they put together on their website. By providing factual, non-stigmatizing information on sexual orientation and gender identity, comprehensive sexuality education that's inclusive can help save lives. It can help tackle homophobia and transphobia. It can help reduce hate crime. It can help encourage reporting when hate crime instances do occur, and make it a safer environment, not just in schools and learning environments, but in society in general. Challenge. I'm not saying you have to go and stand out on the street and shout about being inclusive and including and talk about pleasure, but just encourage positive attitudes to sexual health and relationships, and use positive language, challenge negative language and negative ideas around these topics to encourage pleasure, basically, encourage good experiences. Chris, did you want to say something there? You unmuted yourself briefly.
I did. I know. I was thinking it's when people use the terms themselves against their own body, as well as challenge those negative perceptions people have around their own body parts and the sex that they're having, because it can be a massive block for them accessing appropriate support.
Yeah, and especially in terms of it's not just about sexual body parts. Like, a lot of people have issues with their weight and their appearance. I think it's about reassuring people that everyone's different, everyone likes different things in their partners, and during sex it's about really kind of encouraging themselves to see themselves as unique and individual, and that their experiences are no less valid and they should be as pleasurable as everyone else's experiences. There are resources available to you. These are our websites, and that we all have, all Waverley Care websites have free downloadable resources, but there's plenty of others out there. Like, take some time to do some research around inclusive resources, ways to make your practice talk about specific topics more, maybe just having something up on the wall saying that indicates you're supportive of diversity or different bodies or sex and healthy relationships goes a long way to creating a healthy environment as well. These are just some questions that might help think about how you can include pleasure in your own practice. So we've only got 15 minutes left, so we have got time for Q&A, but I do want people to go away from this training. I always like people to go away and think, well, actually, what do we do? Because you might already be doing some really good stuff, you just don't realize it. Just because you're not talking about sex specifically or different sex acts does not mean you're not talking about pleasure or supporting sex positive messages within your working environment. So look at what you do. Think about what fears or concerns you might have about this work, and how those barriers are influencing your practice. How can resources and activities that are available to you be incorporated into your practice to include pleasure? What conversation starters or questions can you use? Again, it's back to that, take every opportunity you have to include pleasure. If you're working with young people in a general setting and they get a boyfriend or girlfriend, talk about why they want a boyfriend or girlfriend, talk about what they enjoy. Do they enjoy kissing or holding hands? Do they know that the risks and the safety aspects they need to think about, but also how those safety aspects can make their relationship a lot better and more pleasurable and enjoyable as well? What training and support do you need? What barriers there are? And can you involve service users in developing pleasure initiatives? So this is something at Waverley Care, specifically within Waverley Essex, we really love involving service users in. Essex have done some really great stuff. They've got a magazine they release on a regular basis, and they've released podcasts in the past, and they do some really great stuff around involving their service users and members of their community to kind of contribute and encourage a wider kind of well-being messages around sex and relationships, encouraging pleasure, encouraging good sex, encouraging safe sex. So check out the Essex website for some really good kind of ideas you could steal. And again, just think and take some time to reflect about your practice and how your practice or your organization might benefit from including sexual pleasure. So that's our presentation. Like I said, we've got a few minutes left, so if anyone's got any questions, pop them in the chat box or the Q&A box and we will try and answer them. Also, don't feel like you have to hang around and ask a question.
Yeah.
Okay, well, if no one's got any questions, thank you all so much for coming. We hope it's been useful and we hope you've enjoyed it. Any questions, you can get in touch with us via Waverley Care. You can just go on the live chat and ask to be put in touch with myself or Chris.
Yeah, we'll both be there.
Yeah. Email us via Wave or Essex. And if we can help at all with any ideas about how to include pleasure in your practice within the organisations you work in, please feel free to get in touch. Thanks everybody for coming, and I'm gonna stop the recording now.